Hello, my name is Fintan. I work in healthcare. I believe in letting nature take care of us, especially when it comes to our health. In this short video, I'm going to talk about low blood pressure and what you need to know about the dangers of low blood pressure. Low blood pressure may not seem dangerous, and for some people it causes no problems. However, for many people, abnormally low blood pressure or hypotension can cause dizziness and fainting. In a severe case, low blood pressure can be life-threatening. A blood pressure reading lower than 90 millimetres of mercury for the top number, systolic, or 60 millimetres for the bottom number, diastolic, is generally considered low blood pressure. The cause of low blood pressure vary in range from serious medical or surgical disorders to dehydration. Knowing the cause of your low blood pressure is important so that the appropriate treatment can begin. Medical conditions that may cause low blood pressure. Endocrine issues such as diabetes, low blood sugars, adrenal insufficiency and thyroid conditions like parathyroid disease may provoke low blood pressure. Certain heart issues like a very low heart rate, heart attack, heart failure and problems with the heart valve can lead to lower blood pressure. Women during pregnancy have reported a drop in blood pressure. This is because of an expansion of the circulatory system. It doesn't last, and normally after the birth, blood pressure returns to normal. A dramatic loss of blood, for example, after a bad accident or some internal bleeding, will cause a dramatic drop in blood pressure. If an infection enters the body through the bloodstream, it may be a threat to life because of a major drop in blood pressure known as septic shock. Our bodies get rid of fluid each day. If we don't replace what's going out, it may lead to weakness, fatigue and dizziness. We need to take in vitamins B12 and folate to keep our bodies making enough red cells, so a lack of these nutrients can cause low blood pressure. Anaphylaxis or severe allergic reaction triggered by certain medications, latex and insect venoms. This condition can affect breathing and cause itchiness. Other symptoms include an inflamed throat plus an unsafe drop in blood pressure. Medications that can cause low blood pressure are water pills, heart tablets, drugs for brain disease, antidepressants, and drugs for erectile dysfunction like Viagra. The symptoms of low blood pressure. Low blood pressure could signal an underlying issue, particularly if it drops suddenly or is accompanied by signs and symptoms like dizziness or lightheadedness, fainting, blurred vision, nausea, fatigue or a lack of concentration. So when should you see your doctor? If you've got systemically low blood pressure readings and you feel fine, your doctor is likely just to monitor you during routine exams. Even occasional symptoms are lightheadedness or a lack of energy. Your body may be dehydrated for an excessive amount of time in the sun, or you feel dizzy, or if you're prone to fainting. It's important to see your doctor if you have signs or symptoms of hypertension, because they can point to more serious problems. It's useful to keep a record of your symptoms when they occur and what you're doing at the time. Thank you for visiting my site. For more information on low blood pressure and other health conditions, please visit my website. Hello, my